Hi, everybody. Welcome. Those of you that are here at Pritzker, get settled in with your empanadas. And I'm going to go ahead and introduce. So for anybody that has tried to refer to our DBT program and been very disappointed when I told you that we only take ages 13 and up, this is a talk for you. So we're very happy to welcome Francheska Perepletchikova with us today. She's an associate professor of psychiatry at the University of Massachusetts Medical School and is the founding director of the Youth Dialectical Behavior Therapy program that focuses on the treatment of children, adolescents, and young adults within the DBT model. She also founded the DBT for Children Center for Training and Guidance, which specializes in providing training workshops to parents and other caregivers. Francheska is also a co-founder of the Comprehensive Training Center that provides workshops on DBT standard model and DBT for children to licensed mental health providers. Dr. Perepletchikova received her PhD in clinical psychology from Yale University Department of Psychology in 2007. In 2015, she became a DBT trainer at Behavioral Tech, Linehan Institute Training Company. And in 2016, Dr. Perepletchikova became a DBT Linehan Board of Certification, board certified clinician. She has a longstanding interest in emotion regulation, trauma-related psychopathology, suicidality and non-suicidal self-injury, and psychotherapy development. Since 2010, she has focused on adapting DBT for pre-adolescent children with severe emotional and behavioral dysregulation. As a faculty member at Yale University School of Medicine and at the Weill Cornell Medical College, Dr. Perepletchikova conducted several RCTs to evaluate efficacy of DBT for children. This line of research has been funded by the grants from NIMH, NRSA, and private foundations. Dr. Perepletchikova has authored 30 journal articles and book chapters and a book, Treatment Integrity in Treatment Outcome Research. She has conducted over 200 lectures, presentations, and workshops around the world, and we are happy to welcome her today to UC San Francisco.
Well, thank you so much for this introduction, and I am thrilled to be here. Thank you so much for inviting me. I actually, I've been to your wonderful, beautiful city, and I wish I was here in person. And of course, there's so many other things that divide my attention, but I'm hoping that I'll be in California at some time soon and maybe meet some of you in person. In the meantime, we are enjoying the technology, and I'm happy to be able to present to you in a Zoom format. So what you will see today is a very tiny introduction to DBT for children. Before I even begin, I want to emphasize that DBT for children is not just for children. DBT for children is a model that can be applied to adolescents, can be applied to adults. It is in many ways, it's not necessarily about a particular disorder, like for example, only for children with disruptive mood dysregulation disorder and only those who are emotionally sensitive. Because what DBT for children stands for are two main things. Number one, it's a parent-first approach, meaning that we are there to indeed target child's emotional and behavioral dysregulation. However, we're targeting it directly if we have the luxury to do so, and child actually is in session and engaging and wanting to learn. However, having child in session is a luxury. What we need to concentrate on is parents. Parents. We are training a parent to become a super parent for a child who is emotionally sensitive and emotionally dysregulated on top of it, and able and capable to meet the demand of their child. And if we can train that parent to be, so to speak, a therapist for that child, not for children in general, just for that particular child, right? And if we can help that parent know what to do, that's pretty much what we need to do. And all we need is one parent who knows what they're getting themselves into and is willing to do that. Two parents is a luxury. A child on top of it who is willing to come in and do the work is a luxury above luxuries, right? So it's a parent-first approach. Train the trainer, so to speak, right? Train the most important programmer, because if you think about our brain being a biological computer, which for all intents and purposes it is, right? Parents are main programmers, they're foundational programmers, right? And what we need to do is equip them with the capacity to program their child in a way that is going to be conducive to functional, adaptive, happy, right? Life worth living, so to speak. And we call these parents super parents, right? And every child can benefit from having a super parent, regardless of whether or not they have DMDD or any other psychiatric disorder, or whether they have a psychiatric disorder to begin with. Everybody needs to have a super parent. And when we talk about children, I don't only mean like 10, 12-year-olds or 4-year-olds. If your child is a 60 and you're an 80, you still need to know how to validate your child, how to form a relationship with your child that's based on giving, that's healthy, how to reinforce, how to accept, how to be non-judgmental. All of that applies to not just the client. All that applies to the parents of the client, regardless of the age. Of course, the younger the child, the more involvement of the parent. The older the child, 60-year-old, 70-year-old, the less engagement of the parents, right? So it's a model. On top of that, DBT-C, as we will talk about, presents another part to it that we target that is not being targeted in DBT standard model and DBT for adolescents. So just to give you a bird's eye view, DBT standard model, DBT for adolescents, it's about targeting external controlling factors, which means my relationship with the external environment, factors that trigger, reinforce, maintain, shape, extinguish my reactions, right? And what DBT standard model does, it's saying instead of reacting to a stressor in maladaptive ways, such as self-harm, use this skill, like breathing or something else. So this is, in a way, if you think about it, targeting on a level of a symptom, because suicidality, self-harm, screaming, yelling, drug, alcohol use, these are not problems. These are solutions to problems. They are symptoms. What is a level of the problem? Level of the problem is my relationship with me, internal controlling factors. If I hate myself, I'm going to self-harm. I'm going to be self-critical, self-judgmental, self-punish. If I cannot control the only thing I can in this life, me, what I do, what I feel, what I think, my biology, I'm going to try to get an illusion of control by trying to control other people, by making them responsible for making my life easier. Don't stand there. Don't do this. If only you gave me what I wanted, I would not have self-harm, for example, right? If I don't even belong with my own family, if I don't belong with myself, if I feel uncomfortable with my own body, right? If I'm uncomfortable with my own family members, if I don't give to me, how can I initiate and maintain healthy relationship with other people? Because they are based on giving to others. What am I going to give to them? We can only give to others what we have. If I'm self-critical, I'll be critical to other people, and I'll take what they say as a criticism. I'll interpret it that way, right? Even if they didn't mean it. If I have pain inside, I'll share pain. If I have happiness inside, I'll share happiness, right? So what we're talking about in DBT-C is targeting both level of the symptom as well as the level of the problem, condensed into targeting 3 core senses: sense of self-love, safety, and belonging. And anybody that you see, you including, and everybody in this audience have had sustained complex trauma that we'll talk about today. What is complex trauma? Complex trauma is relational trauma, when you are harmfully, or some people traumatically invalidated, screaming, yelling, physical punishment, judging, non-acceptance, criticism, shaming, blaming. All of that is causing relational trauma, complex trauma, meaning what? Causing a person to have difficulty in their relationship with self. Therefore, everybody, whether or not people have psychiatric diagnoses, right? It's irrelevant. Everybody needs to work on their complex trauma and improve their relationship with self. So when we talk about DBT-C, DBT-C, in my mind, made DBT dialectical. It wasn't dialectical before. It was targeting external controlling factors, level of the symptom. DBT-C targets both, level of the problem as well, my relationship with me. And that can be taken and applied to anybody and everywhere. So when I'm presenting to you, that's why The presentation is called Treating Complex Trauma Across Ages. Hold on 1 second. Okay, one more time. Let me know if you can see my presentation. Or at least let me know if you can see. Can you see it? Yes? Okay. I didn't say no. I didn't see a no. That means you can see. All right. So addressing complex trauma across ages. It's not just about children. Let's start with a big bird eye view, so to speak, right? And then funnel in. As we all know, psychiatric disorders, and specifically we're talking about emotional dysregulation and corresponding behavioral dyscontrol. This is not something that a child is born with. This is something that develops. How? If we're talking about the transactional model that DBT standard model discusses, is pretty much a child. We call them a David, so to speak, right? Remember, we said this is our biological computer. We come into this world prepackaged. We don't come tabula rasa, right? Our learning differences, our talents, our predisposition to physiological disorders, psychological disorders, our interests, our traits, our characteristics, all of this is prepackaged, pre-programmed. We call it David, beautiful, wonderful piece of art created by God, universe, nature, whatever you believe in. Never before, never after will be such a beautiful piece of art as you are. And by metaphor with Michelangelo's David, right? This David, when it comes into the existence, this hardware, right? We call it hardware. We use a lot of metaphors in DBT. That hardware that we come with, pre-programmed. When it comes into existence, it starts to transact with the external environment. Learning starts to happen. Every time we think, every time we derive meaning, make an interpretation, act, we learn, we write a program into our software, right? And another metaphor that we use is all of that is within the iceberg. The tip of the iceberg is our conscious awareness. Below the waterline of the iceberg is the rest of our, right? Our software, our hardware, all below this. And we all know it's basic psychological science that 90%, 90, of our reactions come from unconscious. That's why we keep doing the same thing, expecting different results, get the opposite, and keep doing it. Why? Because there's some kind of a program, there's some kind of a function, we're just not fully aware of it. So when the child who's coming into this world, emotionally sensitive, right? And again, DBT-C has been developed for emotionally sensitive children. Again, the application of DBT-C as a model can be to any age, any diagnosis, and with or without diagnosis, because everybody can benefit from having a super parent. Now, when the child comes into this world, right, and we're targeting specifically emotionally sensitive children, we call them super sensors, okay? They come in with more needs because they are emotionally sensitive, meaning that their threshold for emotional arousal is much lower than that of a resilient child. They react to much lower stressors. Somebody did not look at me right? For example, or some kind of an internal, thought memory. And then when there's some kind of a reaction, it goes from 0 to 100, 0 to 100 in a split second, and slow return to baseline. So when that child with all of those needs come into existence with this emotional sensitivity, and the environment is not able to meet those needs because the children don't come with instructions, right? And we usually don't take parenting courses, right? We think that we're all going to be wonderful parents for some reason, even though we ourselves have not probably parented that well. Parents don't know what to do with that child. And the more this child is, presenting with needs, the more the parents cannot meet them. They invalidate the child. Why are you angry? You're not supposed to be angry. Why can't you be like your brother? Just snap out of this. invalidating, meaning communicating to a child, your reactions, your thoughts, your feelings, your behaviors are not understood. They don't make sense, right? Valid means make sense. Invalid doesn't make sense, right? Invalidation means something does not make sense. And they continue to invalidate that child by saying doesn't make sense, doesn't make sense. The more they invalidate the child, the more dysregulated the child becomes. The more dysregulated the child becomes, the more they impact on the environment, the more they dysregulate the environment, and it backs and forth. That's what it's called transaction. It's not interaction. Interaction is two variables, create a third one, but they themselves don't change. Transaction means both. It's like a closed system. They change their behavior, adapting to each other, right? And the product of the emotional sensitivity and the environment's inability to meet the needs of emotionally sensitive children, there are two products. DBT-C is different from DBT standard model in many ways, including understanding the biosocial. DBT standard model is saying emotional dysregulation, irregularity. We don't call it that way. We call it sensitivity. Plus, invalidating environment produces emotional dysregulation. And what we're saying no. Emotional sensitivity and an ability to meet the needs of the sensitive children produces two products: emotional dysregulation of the child and invalidating environment. It doesn't usually start that way. You will see these parents when they come to you, they have, sometimes, several children. Two of their, of the siblings are absolutely fine. The third one is climbing walls. What is going on, right? Because this child needs a very different parenting. And these are very capable parents, right? It's just good enough parenting is not good enough from that sensitive kid. And then it starts the process of the environment becoming invalidating. Of course, some parents a priori are, abusive, neglectful, absolutely, but 99%, no. Capable, well-meaning, wonderful, very, trying and attempting, wonderful people. They just don't know what to do. Now, DBT dialectics standard model, right, is acceptance and change. And of course, DBT-C took all of the procedures and principles and strategies of DBT, comprehensive model, and added a lot of other components that we'll talk about it, right? Made DBT-C very different from DBT standard model. Now, this is the main dialectic of DBT standard model. Now, DBT-C adds another dialectic to it, right? But before we get to this one, remember we talk about validation means makes sense, invalidation means doesn't make sense. So validation is you just saying, I get it. Why you did it, said it, acted that way, felt that, had that kind of biological response. It makes sense to me, even though I don't approve. Validation is about acceptance, not approval. And we only need it when something is happening that we don't like, right? Invalidation means that something doesn't make sense. Now, invalidation is not a bad word. We therapists are hired to invalidate the hell out of our clients because they came to us for change. And change means invalidation. Your means and your goals don't match. I just invalidated by saying you're trying to create life worth living and you're trying to kill yourself. Your means and your goals don't match. I just invalidated. Okay. Now, understanding it is very important for the discussion that's going to follow. Now, response makes sense given the cause. That's validation. I understand why. And every behavior has a cause. Every response have a cause. Every feeling, every thought has a cause. Therefore, everything has validity. And whatever it is that you did, said, even though I understand it, and this is the paradox, two things happening at the same time, right? And they're opposite, complementary. It makes sense given the cause, and it may not make sense given the goal, the invalidation, what's invalid in the response. Both. Things are not mutually exclusive. They're parallel, the dialectics of our existence. Now, As we said, validation justifies, corroborates, indicates I get it. There's a kernel of truth behind your reaction. And again, a lot of the times what we're dealing with is environment that is not a priori emotionally abusive or neglectful. It becomes invalidating. And when we talk about invalidation in that sense, we add harmfully or traumatically invalidating, right? Not just invalidating, because invalidation is just about regular change, right? Harmfully or traumatically invalidating. And what is the definition of that? Is this when invalidation is pervasive and indiscriminate. Everything is invalidated. What makes sense, what doesn't make sense, everything. Now, their difference here is what type invalidation we're talking about, right? We have corrective invalidation. That's what we use, therapists, harmful invalidation, and traumatic invalidation. Now, what is the difference? Corrective invalidation. These are your goals. These are your means. Do you want to change course? Plus, very important, feedback is only given on a level of response. What you did, felt, thought, your biology, never about you as a person. You just are. Harmful invalidation. These are your goals. These are your means. Do it. And it's not only on a level of response, also in the level of a person. When I'm saying, and I don't even need to say, you're an idiot, which is an example of harmful invalidation, criticism, judgment, shaming, blaming, name calling, right? I can just say, why the hell did you do it? Which implies that I'm an idiot. And what I did is empirical evidence for me being an idiot, right? So this is harmful invalidation. What is traumatic invalidation? It's not only providing feedback on a level of a response and person being critical. Here you're treating that person as an object. Their interests, their pain, their suffering is disregarded. This is physical, emotional, sexual abuse. Now, these are some of the examples that I gave you, right? Like, a corrective feedback every time that I teach a skill. Every time I'm doing cognitive restructuring, all of these are invalidation. I'm saying, don't do that. Do this. I just invalidated. Criticism, judgment, silent treatment, retaliation, threatening, shaming, harmful invalidation, physical, emotional, sexual abuse, traumatic invalidation. Now, let's talk about levels of harmful invalidation very fast. And this is important. Now, there are such things, harmful reinforcement, harmful behavioral modification, behavioral control and judgmental stance. All of these are harmful invalidation. Okay, let's go very briefly through them. Harmful reinforcement. And we're talking about levels here. The lower we go, the more damaging this is. When I behave, I am a good boy. What does that mean? We just made it personal. Meaning that positive reinforcement, attention, praise points, is given in a way that associates your response with you as a person. As simple as that. By saying, oh, what a wonderful job you did, such a good boy. That's it. What you just did, you merged who I am with what I do. And this is very important. Everything is dialectical. We, most of the time, our experience, our thoughts, our actions, our mental attention goes to the conditional side of our experiences, right? I achieve, I fail, people like me, people don't, I'm happy, I'm disappointed, win, lose, make a mistake, gain mastery, right? Ups and downs in life, if then contingencies. If there is a conditional side of the world, there must be an unconditional side. What is the unconditional side? Personal. I just am, neither good nor bad. When that child is born in this world, is this child good or bad? Neither. It's an entity called human beings. Just like sun is an entity of stars and earth is an entity of planets. Sun cannot be bad for burning my skin or good for giving me light. Sun is sun. And it gives me light, burns my skin, whatever. You see, now I'm in dialectical balance. Both. And when we talk about dialectical balance, it always be this way. One side is stable, another flexible. I just am. And I succeed, fail. People like me, people don't. What happens in the information field in which we exist, it merges my relationship with me with my relationship with other people and how well I fare in life, making me one-sided and stuck and suffering. Because all day long, I succeed, I'm good. I fail, I'm bad. People like me, I'm good. People don't, I'm bad. All day long. Number one, it's insane because that's not so. I just am. My relationship with me is unconditional, meaning there are no conditions that needs to be satisfied for me to be at peace with me. What we do with DBT-C is exactly that, helping people understand that and cut the connection between I just am and I succeed, fail, people like me, people don't, so that we indeed can maintain dialectical balance in the way that we act and how we respond to things. So harmful reinforcement does what? Merges who I am with what I do by simply adding good girl or good boy. Plus, positive attention is not provided outside of the reinforcement. There is very low reciprocity, meaning doing things with the child that's fun, right, on child terms, and rare or lack of random expression of love. What does it mean? Child passes you by, you say, love you. It goes this way, you go that way. Not great job, I love you. Ugh, terrible, you just made love conditional. It's so important how we talk. Every time we say something, we wrote a program. Think about it. Now, if I behave, I'm a good boy. Next level. If I misbehave, I'm a bad boy. This is harmful behavioral modification. This is using ignoring a punishment. However, using it in which way? Associating it with personal, positive attention not provided for positive opposite behaviors, no reciprocity, rare or lack of random expression of love. I behave good boy, misbehave bad boy. Next level, behavioral control. I'm not even important because environment prioritizes their own need at my expense, which is bribing instead of reinforcement, accommodation instead of shaping, retaliation again instead of punishment, silent treatment instead of ignoring. And as you can imagine, right, when we talk about parents, those are the main people in a child's life. When a parent is communicating, you're not important, I'll be satisfying my own needs at your expense, this is so much more damaging than anybody else because parents are foundational programmers and unquestionable authority. We'll talk about it later. Now, there are three types in dynamics in parenting, right? My gain, child's gain. Reinforcement, having fun with children, everything is good, right? My loss, child's gain. My loss meaning what? I don't want to do it. Ignoring, I don't want to do it. Point charts, I don't want to do it. Validation. Validation is mood inconsistent. I don't want to validate when I need to validate. My child just called me names and told me that I'm a son of a bitch and I'm supposed to come back and say, I understand why you called me son of a bitch. Mood inconsistent, counterintuitive. My loss, child's gain, and my gain, child's loss. Most of the time when parents come to us, they're right here. My gain, child's loss. And we want them to be here. My gain, child's gain. My loss, child's gain. Listen, your parents, you had those children. We owe nothing to anybody except for ourselves to learn about my David, to love my David as I am unconditionally, and to live, self-actualize my David. And I owe to my children. I made them, I'm responsible, not what they want, what they need. I behave good boy, misbehave bad boy. I'm not important. Next level, judgmental stance. I'm defective. Judgment, blaming, shaming, all of those things, right? Attacking person's integrity. And again, of course, the most detrimental when it comes from parent who are unquestionable authority. And the last level, now we are in traumatic invalidation. I'm nothing, meaning that you're being treated as an object, like a stone. If you take a stone to nail something into the wall, you don't care about stone's wishes about being used as a hammer or feelings about being used as a hammer. No, it wouldn't even occur to you, right? So being treated as an object. And as you can imagine, of course, that's such a feedback, especially detrimental when it comes from unquestionable authority, such as parents and foundational programmers. Now, we get to what is it that we're targeting? One of the things that we're targeting is, of course, this personal trauma, complex trauma, and everybody sustained it to whichever degree. And when complex trauma is being sustained by emotionally sensitive children, it's even more detrimental to them. Again, emotionally sensitive does not mean immediately emotionally dysregulated. No, there are a lot of emotionally sensitive children that become very functional adults, right? It's a transaction with the environment. They didn't know how to address the needs. That's what does it, right? So complex trauma, just to make sure we're on the same page, relational trauma, it stems from harmful invalidation. PTSD, it's usually a single traumatic event, natural disaster, warfare, and accident, right? And also traumatic invalidation, right? Traumatic event, traumatic invalidation. And complex PTSD is repeated, right? Multiple times, right? Of harmful or traumatic invalidation. So what does DBT-C do with complex trauma? So we are addressing complex trauma with strategies that are external controlling factors, right? And strategies for internal controlling factors. I'll explain everything, don't worry. Plus, we have additional intervention as needed. For PTSD or complex PTSD, we need to do external, internal, and bring in additional interventions, such as, for example, Melanie Hardin, prolonged exposure DBT techniques that we incorporate at needs basis. All right. So just to repeat before we jump in, two sides to our existence. Everything has two sides. Everything is dialectical, and these things are not the same. They're complementary, right? Day, night, life, death, day, night, good, bad, yin, yang, whatever. Conditional side, external controlling factors, unconditional, internal. Conditional side, relationship with the external environment, unconditional, my relationship with me. Conditional side, all emotions, thoughts, actions, because they're all triggered, if-then contingencies, right? Unconditional side, I'm an entity, neither good nor bad. Conditional side, win-lose, roller coaster of life. Unconditional, I just am, neither good nor bad. Neither. Therefore, I can always, always be at peace with me personally. I may not be at peace with other people, but I can always be at peace with me regardless of what's happening. If I can cut the connection of conditional good enoughness, regardless of what happens in my life. This is what we teach. This is what we practice. So let's take a look at both. External controlling factors, internal. So what are external controlling factors? Events that elicit, reinforce, punish, extinguish, shape responses, right? And we teach how to deal with stressors coming at you instead of using maladaptive responses, solutions such as self-harm, drinking, drugs, use emotional regulation techniques, right? So internal controlling factors, my relationship with me, or senses of self-love, safety, and belonging, and vulnerabilities in them. So external controlling factors, level of the symptom, internal, level of the problem. This is relationship with the environment. This one, relationship with me. This one is standard DBT, DBT-A. This one is called core problem analysis. We're analyzing core problems, core senses, vulnerabilities in core senses, and how they influence our ability to function, and provide specific intervention additional to DBT standard model to address those vulnerabilities. And all of that is DBT for children. Let's look very briefly at external controlling factors. What does DBT-C did? DBT-C took DBT standard model, all principles, theoretical framework, strategies, procedures, virtually no modification. What we added to it was huge, extensive, parent training component. Remember, parents first. And some of the major modification, as you've seen in biosocial theory, our treatment target hierarchy, instead of 4, it's 10. I will not go into that because it takes a village to raise a child. We're no longer working with just one client. We're working with the entire system in which this client is embedded. Parents, grandparents, babysitters, teachers, God knows what. And we need to be able to know how to prioritize, right? When our targets are competing. So also we modified skills training to digest it to a child at age 7. Phone coaching has been changed. We don't want the child to go for consultation on what to do to the therapist. If they want to, absolutely, they can call me. Number one, what 7 or 8-year-old is going to call you for coaching? Please. Some of them, yes, but no. And we want them to go to their parent for coaching. We want to make sure the parent knows what to do, but we also want the child to go to, because this is what's natural. And we want to train the parent to become this therapist, right? And then parent goes to the therapist for coaching, right? Now, this is what it is. Therapist becomes a parent to parents for the meantime, because you are reparenting the parent. It's not just addressing the child's concern. No, we need to teach the parent what to do, which is necessary, not sufficient. Also give the parent the capacity to do it. This is work on their own self, meaning that we're providing individual therapy to parents. We're providing couples therapy if both parents are present, and so forth, to give them the capacity to do all of this work. Plus, we moved, some of the aspects of DBT in a standard model in different pieces, and commitment is not required of a child. Not at all. We don't care about child's commitment. They don't even know what it means or can make an informed commitment. 100% required of parents, and we're spending a lot of time making sure that parents make an informed commitment to what they're getting themselves into. Now, the main mechanisms of change in DBT-C, we're talking about external controlling factors. Number one, parental emotional regulation. I cannot regulate a child in dysregulated environment. It doesn't work. Number two, we need to put a foundation of change, which is what? Validation. And number three, skills practice. You see, I did not say skills use. Skills use is our goal. Skills practice. Every single day, parents are supposed to practice skills with their child in pretend mode. Let's pretend your sister came into your room and touched your stuff on purpose. What you gonna do? And then they role play. Parent becomes the sister, and child needs to breathe, walk away, ignore, use eyes, whatever. And then they get points for it. Listen, that program of I'm upset, I freak out, that's a program, has been coded and recoded for many years, multiple times per day. It's a very strong program. Us teaching a skill and expecting that the child, in the moment of emotional tsunami, all of a sudden is going to stop themselves and say, wait a second, maybe I need to use breathing instead. Forget it, right? How many times will that happen? Once in a blue moon. We can't override the program I'm upset, I freak out with I'm upset, I use a skill, waiting for the skill to happen in an actual situation. We don't rely on that. Again, that's our outcome. The process is what we can control. Therefore, we practice it in pretend mode every single day. Quantity, 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 quantity. Child using the technique when they're actually upset. Qualitative jump. First principle of dialectic. Now, I know there's just so much to discuss about the external controlling factors. However, I need to move on. I will give you barcodes for you at the end of the presentation that will get you to specific sites where you can learn more about DBT-C and the trainings and everything else. But for now, please remember that this is just a very brief introduction. Now we move to internal controlling factors, the core problem analysis. What is this all about? Those of you who are CBT therapists, this is downward arrow technique on steroids. It goes all the way down to hardware. What are we targeting? We're targeting to understand functions of the behavior. All behaviors are multifunctional, and therefore each behavior may require different interventions. Self-harm. What are the functions of self-harm? Coping, retaliation, belonging to a peer group that self-harms, cry for help. I'm this, a dark person that self-harms, punishment. Coping skills match which function? Coping with distress. Excellent. If the function for my self-harm is to cope with distress, to relieve that emotional arousal, then using skills matches that function. There is a pretty good probability a person will actually do it. But what if my function of my self-harm is to self-punish, to retaliate, to belong to a peer group? I will not use skills. It goes opposite to the function. Therefore, understanding the functions of the behavior is key. We do not match interventions by behaviors. We match intervention by the function of the behavior. Therefore, the same behavior may have different interventions attached to each of the functions. But first, we need to understand what are the functions. Most of the time, people are completely oblivious why they do what they do. And co-problem analysis is a cognitive technique to help us understand what are the functions behind the behavior that person is not aware of. It's not conscious. Yes, and this has nothing to do with psychoanalysis. And if you're a DBT therapist and you think that you are not working with unconscious, yes, you are. What is insight? What is identification of patterns? What is generating and testing hypotheses? All of that means, I don't know why I'm doing, it's not conscious yet. You're working with unconscious and making it conscious by using these techniques. CPA is just one of the other cognitive techniques that is dragging from the unconscious on the level of consciousness so that we can say hi to that. Oh, that's why I am doing it. Moment of mindfulness. And now you have a freedom of choice to override it. You can still do whatever it is, but now you have a freedom of choice. Before you didn't. That's why we keep doing the same thing, expecting different results. Definition of insanity. So we're identifying functions of the behavior going all the way to the core, meaning what? All the way to from the software to the hardware. What is hardware? Where I can no longer ask a question, why? Questions for function is why, right? Why do you need it? What does it do for you, right? Why is it a problem for you? You are hardware when you can no longer ask a question why, because asking a question, why do you need to love yourself or be safe, is like asking, why do you need to breathe? I don't know, because that's how it was designed, meaning what? You were born that way. You did not decide it that way. You didn't write it that way. You were pre-programmed with it. That's why me asking you why is nonsensical, because you were not the one to decide it. I can only ask you questions why on what you wrote, your meanings, your interpretations, your software. So what we're here to do with that analysis, understand the functions of the behavior and understand the vulnerabilities in our three core senses: self-love, safety, and belonging, and provide interventions to intervene and help people decrease those vulnerabilities in a healthy way. Now, let's go very fast. What's self-love? Sense of self-love is not self-love. Self-love is an instinct of self-preservation. Self-love is ability to experience it just because at will. And we have a way to do this. Actually, it's very simple, not easy. Simple, not easy. That's the paradox. I'm not going to go into each and every of those senses because I don't have the time, but I have a huge discussion of that on my website called childdbt.com. If you go there, what is DBT-C? There is a subcategory called what is core problem analysis. You can read as much as you want on that. So sense of self-love is ability to connect to your self-love as you are, just because. Understanding that what we're doing, we're assigning conditions of good enoughness, tall enough, smart enough, successful enough, whatever enough. And only then I can love myself and be at peace with myself, which is insane because you're assigning conditions to achieve something unconditional. That's why it doesn't work. We all can connect to our self-love. We all have it because it's an instinct of self-preservation. And of course, when parents are not able to provide children with unconditional love, that makes a person what? Assign condition to please the parents, to make them love them and all of that stuff. So we're training our parents to see our children to see love as conditional. And because we're harmfully invalidating and sometimes traumatically invalidating, what are we doing? We are continuing to signal to the child, no, you're not good enough. You're not good enough for my love. What is kind of a relationship with self can that person develop seriously? And giving them skills is very, very important, but they may not have a capacity to use those skills because they need to continuously punish themselves for being bad. So giving them skills is going to go opposite to the function of self-punishment. That's why a lot of the time our clients burn out, because we keep giving them skills. They may be using them once in a while, but most of the time they don't do it consistently. And then they come to us. And then what do we do? Oh, not enough motivation. Client blaming. Oh, not enough skills, knowledge, more skills. Well, try this, try that, try this, try that, right? Burning out the client and burning out the therapist. Marsha said 90% of therapeutic mistakes come from failure to assess. And when she was in a bad mood, she would say 100% of therapeutic mistakes come from failure to assess, right? Assess what? Why? Because only then we can match function of the behavior to the intervention closely, that increasing probability of that actually working. Now, sense of safety is not safety. We can't assure safety, right? Sense of safety is about my ability to predict and to control. What can I predict and control? Me. I can only predict with any certainty what I'm going to do. I can only control me. I can't control other people, life and circumstance, right? So sense of safety is about accumulating an ability to control the only thing I can me, plus resources, knowledge, and connections sufficient to handle challenges, right? And that sense of safety starts to develop in an environment that is protective, that is stable, that is supportive. Talk about invalidating environment, none of that is happening. That's why our children who come to us with emotional sensitivity and emotional dysregulation has so many comorbid anxiety disorders, because their sense of safety is out of the window. They are in the environment that is not protective, not supportive, accommodating, and perpetrating most of the time. Plus, they can't control the only thing they can themselves. Of course, they're going to have a whole host of anxiety disorders, right? Now, sense of belonging. Everything is dialectical, including our David. All of this is prepackaged. The instinct of self-preservation is there. They need, for safety. Nature doesn't care if we're happy. Nature cares if we're safe enough so we can live long enough to procreate, right? So, and sense of safety is about control. Like when these children are screaming, yelling, punching, this prehistoric monkey comes out trying to claim control or get the illusion of control, something to decrease vulnerability in their sense of safety. And we are all control freaks to whichever extent, some more, some less, right? Little kids. First word is mama. Second, papa. What is third word? No. No is a word of control. This creature that's barely walking and talking is already starting to exercise control. If nature were to leave it at that, we would kill each other off. It counterbalanced it with inborn benevolence. They need to associate, congregate, be there for other people, support the young, the old, and the sick, right? Our need to associate with other people and be in groups, because we're not predators. Look at me. I don't have fangs. I don't have claws. I don't have a tail, nothing. I cannot. You drop me in the middle of Serengeti, I'm eaten by lions with all of my brain. Drop me with a group of people, much higher level of survival, and I need to be able to indeed belong in a group and be in a group despite all of my prehistoric monkeys and need for control, right? So sense of belonging. And of course, it develops within the family like everything else by feeling welcomed and accepted and appreciated as a part of the group. And when parents, tell you, who are you? I can't even imagine how I could have had a child like you, or criticizing or judging or communicating any messages that the child is not good enough, not accepted, or not even wanted in their family. How can they form good relationship with themselves and other people. So again, all of the things that we're teaching in terms of the external controlling factors, all of the skills, all of the cognitive restructuring, all of that is nice and merry. None of that is going to be as useful because it's knowing what to do. You also need to have a capacity to do it. Working on vulnerabilities in relationship with self, that's what's giving you the capacity to use all of that. Social skills, fantastic and wonderful. But if I hate myself, if I am self-critical, self-judgmental, if I'm in pain, if I am punishing myself with self-harm, God knows what can I give to other people? How can I use those social skills? Maybe once in a blue moon, not consistently, because healthy relationship is based on what? Giving. I need to be able to give something. I can only give what I have. If I have pain, I'll share pain. Have happiness, I'll share happiness. It's as simple as that. It's very easy to see how the person is inside with themselves, see what they do to other people. So help the person heal the relationship with self, and then all those wonderful skills will be readily applicable and they'll be able to use it. Now, the primary function of all responses, adaptive or maladaptive, is to decrease vulnerability in our core senses, self-love, safety, and belonging. It's just maladaptive responses decrease vulnerability short-term, increase long-term. And adaptive responses do the flip. Very important. Let me go through so I'm going to give you a skeleton of the core problem analysis, right? It's much more complicated. Non-suicidal self-injury. So why do you need to self-harm? Because then people come running. Why do you need that? Because then I get attention, support, care. Why do you need that? Because then people love me. Then I'm good enough to love myself. And therefore I feel protected. And I'm no longer alone. Self-love, safety, belonging. This is a program. This is a very rational, logical program. This is a biological computer. Programs are rational, 100%. Dialectic, paradox. This is a very rational program. And it's insane at the same time. Yeah. Paradox is the only norm of our existence. For me to love myself, I need to self-harm. For me to be safe, I need to self-harm, right? So short-term, yes, decrease in vulnerability. Okay, good. Okay, safe. Long-term, disaster. Adaptive responses do the flip. Now, how do they do the flip? They may increase vulnerability in these core senses temporarily, decrease long-term. So anytime we have a challenge coming our way, we're presented with two doors, door of pain and door of suffering. What is pain? Actually normal part of life. Challenges that come our way, and the only way for us, we can avoid them. And that's how we learn. We learn mastery. We learn next level of understanding and skills by facing challenges. So that's a door of pain. Why is it pain? Because challenges bring uncertainty. Sense of safety doesn't like uncertainty. Therefore, when we go through the door of pain by facing a challenge, sense of safety, what if I'll make a mistake? Sense of self-love, what if I will not be good enough? Sense of belonging, what if everybody will think I'm a schmuck and not want to be with me? But then once we get through it, you see, increase in vulnerability short term, it's not easy, it's hard, right? And once we arrive on the other side, all other doors are there with self-actualization and improved mastery and improved self-control and ability to give to other people by giving to yourself first and so forth. Or if we don't accept pain, we go straight into the door of suffering, open it, and there's a wall, and you just stand there and you bang your head on that wall saying, it's not fair, I didn't cause it, I'm not the one doing it, blah, 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 increasing vulnerabilities in all of your core senses. Now, once we identify what that sense is, we have CPA-specific interventions on what to do with each and every one of them and how to reduce those vulnerabilities in a healthy way. So just to give you a summary, two sides, conditional, unconditional, relationship with external environment, relationship with self. All responses are unconditional side. On unconditional, I'm an entity. Conditional side, win, lose. Unconditional, I just am. Self-love is the only emotion that is present on the unconditional side. Sense of safety, fully conditional. You need to get self-control. You need to accumulate resources, connections, and knowledge. You're not given, you're not born with that. Sense of self-love, fully unconditional. Sense of belonging, both. Unconditional in terms of the ancestry, family that you were born in, you didn't choose it. Conditional, all of the relationship that you develop with your partners, friends, your own children. And when we have a problem with conditional side of the existence issues, right, we use our adaptive coping skills and other things. When we have issues in relationship with self, also adaptive coping skills. Think about it, everything is connected. When we're teaching skills, we're teaching self-control, and therefore go straight into reducing vulnerability in the sense of safety as an example of how everything is connected. Plus we use CPA. And thank you so much for attending. Here are some barcodes. So my site called childdbt.com, that's where you're going to get all the extra information, extending everything that I talked about today. And the Comprehensive Training Center, this is the center that I established with my business partner, Holly Harris. We are offering trainings in DBT-C, in DBT basics, and we're starting to actually offer trainings in core problem analysis, because this is transdiagnostic approach, because it's about figuring out a function behind a behavior, and every dysfunction has a function. Plus, it's irrelevant what age it is. The youngest child I taught how to sit with self-love was 4.5. Actually, the younger the child, the easier it is. And you know, all across ages, and it can fit in any therapeutic model, DBT, CBT, chemotherapy, psychoanalysis, doesn't matter, because it's function, analysis of function, and interventions to decrease vulnerabilities in our relationship with self. And we all have sustained complex trauma, so we all need it, regardless of whether we're a client or a therapist, whether they're functional, normal way in which we live day to day, or we are struggling with everyday issues. Thank you so much for your attention.
Thank you, Francheska. I'm sorry, you guys, you will notice we are at 1 o'clock. So I know people have to run places, so we don't have time for questions. But you've got the links and everything else, so you can follow up with Francheska if you have any. Thank you so much.
Thank you.